2 years have passed since medical marijuana has been approved. Doctors have been asked to prescribe this drug for patients with MS, glaucoma, epilepsy, cancer. To provide compassionate care for suffering individuals requires understanding the difference between medicinal use, recreational use, and outright abuse. So what is the difference between marijuana as a helpful medication versus a drug that can cause confusion, slowed reaction time, even addiction? Another issue is public safety. If medicinal marijuana can cause cognitive and physical impairment, is it safe to use in the workplace? Do you want your bus driver to be smoking a joint? Is it safe to use in a workplace like a nuclear power plant? Let's learn about medical marijuana and its implications on today's Toronto Speaks Addiction. Welcome to Toronto Speaks Addiction. I'm your host, Dr. Vera Tarman, and tonight we're discussing medical marijuana. 2 years ago, doctors were asked to prescribe marijuana. Since then, we've been wrestling with concerns about how to prescribe the drug, even while clinics are mushrooming around us, selling pipes, bongs, and the drug itself. What is medicinal marijuana? Is it different than the recreational use of the drug? Is it possible to even prescribe this drug cautiously in the workplace? Joining me tonight is Dr. North Nachim, a physician who works at a Toronto cannabinoid clinic. He will tell us about the proper prescribing of medical marijuana. We are also privileged to speak with Aaron Spodek, who is the president of Vector Medical, a company that is interested in developing a safe workplace. He will tell us what precautions are necessary for safety-critical positions like the airline industry and hospitals. Is it safe to use performance-altering drugs like marijuana in these work sites? So thank you very much for both of you to come to the show tonight. And I'm going to start with you, Dr. Nachim. Can you please tell us what medical marijuana is and how is that different than the non-medicinal use of it?
So I think to start with, we have to be, marijuana is a plant, the cannabis plant. And when we talk about medical and non-medical marijuana, we're essentially talking about the processes of how the plant is made. We have a system that exists in Canada where the plant is grown by regulated businesses, licensed producers, and in these facilities the plant is tested for THC content, CBD, so these are the different cannabinoids.
Yeah.
It's also tested for heavy metals and other contaminants. When we talk about non-medical marijuana, we're essentially referring to street-level marijuana that people might grow in their homes and in different facilities. This is sort of it's a distinction that exists today. But when we talk about the medical uses and non-medical uses, we move on to more the clinical and the use of when a person uses it, they might be using it for different reasons. So traditionally, most people that start using cannabis might start in high school or in university in their younger years. They'll experiment with it for a few years. Some people will use it a few times and they stop. Some people use it and they use it throughout the years. So at some point in their lives, if they're sick or they're ill with a certain condition, a person might, whether they're given by a friend or they have been using continuously, they might find that cannabis provide some kind of symptom relief. And at that point, their use might become more medicinal, just like we do with other drugs. Over time, this person can become as well dependent on it. And this is something we can talk about later on. But the central meaning of medical versus non-medical is how a person is using it.
Okay, but it's also, it does have to do with the actual ingredients of the drug itself. And I remember reading somewhere, I think it was a CBC, they did an investigative report where they looked at the marijuana that exists today, and some of it virtually had no cannabinoid in it at all, or very little, and it was very high on the THC. So do you want to...
So I think it's important to clarify to our viewers that a plant, the active compounds that's most prominent in the plant is the THC and the CBD. So the plant makes different concentrations of these two chemicals.
Yeah.
There are other chemicals in the plant as well. other cannabinoids, and up to 60 of them have been discovered, 60 to 70, and we actually know very little about these other ones. We do know that the psychoactive aspects of the plant is due to the THC itself, tetrahydrocannabinol.
Yes.
In addition to the cannabinoids, there are also other chemicals in the plant called terpenoids and flavonoids, and that's what gives the plant the smell and other features. And it's thought that the combination of all these compounds together is what provides the effect.
But what is the medicinal part of that?
So we, in rats and in cell studies, they've identified that a lot of these compounds can have clinical effects or physiological effects for diseases. And they're being studied right now, but there's a lot that we don't know. When we talk at a clinical level, and then we're talking about someone who uses it for medicinal purposes, the two main ingredients that have been studied for this purpose is the THC and CBD. So although when most people, the CBD does not psychoactive, so it doesn't cause the high that comes with it.
Right.
And it's thought that it helps with certain conditions, but the THC also has clinical effects. So even though it does cause psychoactive effects, it's thought that THC at lower doses, it's been studied, it's been shown that it does have some benefits for certain medical conditions.
Would it be fair to say that medicinal marijuana would be heavier on the cannabinoid or the CBD and less on the THC?
Not necessarily. From my clinical experience, and this is again early on, we don't have a lot of data on this yet. Yes. Some patients benefit from the cannabidiol, the CBD. But some patients don't respond to that, and they do respond to the THC. THC has been shown to help quite significantly with nausea and vomiting, for example, certain types of pain. Even though there is the potential for psychoactive effects, the THC does have potential medicinal effects as well. So I think it's important to notice that just like with opiates and other drugs, you can get the effects. I think it comes down to how somebody uses it. And when they use cannabis, are their functions improved? Are their moods better? Can they do more with their lives? And that's what it comes down to when you use the plant as a medicine. Okay,
so given that you might have to use the THC, and that is part of the psychoactive effect, and that, from my understanding, does have some cognitive impairment, some physical impairment. I mean, do you want to elaborate on that? Because then I'm thinking, what do we do when we're in the normal world and we have to be on a drug that actually alters us?
And so this is a very difficult question, and one that we're still trying to figure out as a society. As when the employer is trying to figure out, I think everyone's trying to figure out, what do you do when someone has a medical condition, they're prescribed cannabis, and it's got THC, and they have to work, and becomes a concern, especially in safety-sensitive positions. And we do know, just like with any medication, there are side effects to it. If we consider cannabis as a medicine, there will be side effects to it. And there is concern with impairment. Mostly it's psychomotor and neurocognitive. So
can you elaborate a little bit on that?
Sure. So we know from studies there's many types of impairments that happen with cannabis use. There's the obvious acute intoxication when somebody uses it, and that lasts about 4 to 6 hours. It depends if they're smoking it or if they're ingesting it. With ingestion, it's usually a little bit longer, can last up to 8 hours. But we do know that there's impairment in sometimes with their memory and their ability to focus, attention, to perform tasks. And there's a lot of studies that's been done that shows that someone will not perform as well. There's also other types of impairments that can persist even for someone who's a regular user. Even after they stop using cannabis, we know that there's certain impairments that will last for days and even weeks after they stop using marijuana. And that's the concern in the workplace for someone who's been prescribed. Just like you said, with pilots, airplane pilots, they did a famous study a few years ago where they administered cannabis to pilots, and they tested, they went into a flight simulator, and they noticed that 24 hours after they used, they didn't perform as well compared to someone who had not used it. So
Aaron, let's bring you into the picture, because you're the person who knows about the workplace issues. And so given what Dr. Nachim has just said, I mean, how does a workplace have to accommodate, and if so, how do they accommodate a medical marijuana prescription?
Sure, and it's a very complex question because there's labor law, there are approaches that unions take towards it, there are approaches that different industries take towards cannabis and drugs in the workplace. And the common misconception is that medical marijuana is like recreational marijuana when it comes to a safety-sensitive workplace. That, you know, it's, if someone's using it, then they would fall under the same category as someone who's using recreational cannabis, and therefore would be in violation of a workplace alcohol and drug policy. What's actually true is that medical cannabis falls more within the category of any other potentially impairing medication.
Okay.
So there's a lot of stigma, and there's a lot of
Well, tell me what some of the
background.
myths are that you're dealing with, that you're trying to sort of right or straighten out.
Well, part of it is just companies looking at it and saying, well, okay, this is cannabis. People use it recreationally.
Yeah.
It's still technically illegal in Canada
Yes.
for another few months.
Yeah.
And the issue is, well, how can you use something that's illegal as a medicine? And if it's a violation of policy to use it in the workplace non-medicinally, then how can a prescription just make it acceptable? So the answer to it is that when you do have a prescription for it, when you do have medical authorization to use it, it is considered a prescription. It is considered like any other drug. But the misconception on the other side of employees who are using it is that, well, I have a prescription to use it, and therefore I can use it in the workplace. But it comes back to the discussion around, well, if you had a prescription for an opiate, a Percocet or oxycodone, or if you had a prescription for an antipsychotic or an antidepressant medication, which also have side effects that may impair a person's ability to work safely or a person's ability to work productively, there would also be an obligation on the part of the employer to investigate that and to make sure that the person is going to be safe. And in addition to just making sure that person themselves is safe, they also have to consider the workforce in general. If there's a workplace accident and it comes to light that the person had a prescription for medical marijuana, that typically becomes the entire focus of the investigation. And there could be significant liability on the part of the employer in terms of criminal responsibility for having not ensured that the workplace was safe.
Now, you raised the issue about opiate use, and you could say the same thing for benzodiazepine use. So if you use those to the point, well, the way that they're used recreationally, I mean, the person is... medicinal use is, you know, 2 Percocets every number of hours, and I guess the understanding is there's just the amount that you need to treat the condition but not to impair the person, whereas recreational use doesn't really matter. But do we have that even, those kind of guidelines yet, so that we can say this is the amount that is safe for somebody versus not?
And I think this is one of the problems that we're facing. We don't know exactly. We have a vague idea, and there's recommendations by the College of Family Physicians of Canada. They've come out with a preliminary guideline based on the literature that we have, but we don't have a lot of this information. And I think part of the problem is there's a huge discrepancy as to how much doctors are prescribing and the potency and the different strengths that are out there, and people, the way they use, that a patient might use this. So unfortunately, we don't have a standardization yet to know exactly what dose causes what. And even when we compare, if we were to compare cannabis to alcohol, for example, with alcohol, we know when someone drinks and they come to work or they get stopped on the side of the road, we have good tests and they're reliable and they've been used over and over again to know that there's a direct relationship versus with the amount that they've drank and impairment. With cannabis, we don't have that yet, and that's what part of the problem is.
No. But the thing in the workplace is, because there's no real medicinal use for alcohol, you can just say no alcohol. So any alcohol is considered an infraction.
But with alcohol testing, you're really testing for impairment. So you're testing for a very small window. With cannabis testing, or with testing for THC in the workplace, the most common type of drug test that they use is a urine screen. And urine can contain THC metabolite for up to 28 days, right?
Yes.
So, so the whole idea, and this is a nice segue into the whole idea of cannabis legalization and how workplaces are going to deal with that. One of the things they're struggling with most is if it's legal, is a person allowed to use it on their free time if they work in a safety-sensitive job and they'll fail a drug test,
Yes.
which typically would disqualify someone from being able to work in that. And there would be an investigation, potentially there would be some type of disciplinary action potentially taken against that individual. So looking at, you know, an impairment test for cannabis or for THC is something that is sort of the million-dollar question of who's going to produce that and what is going to be the standard type of test. And if we have that, then the whole question of someone using recreationally on their free time becomes very similar to alcohol.
Mm-hmm.
But at this point, because the testing is so different, yes, someone can use alcohol on their free time, because if they do a test, they're not going to fail it unless they drank within 24 hours. But with cannabis, you could have used it 2 weeks ago and you still fail the test. So how can a person, you know, use recreationally if they're going to be failing that test?
I just wanted to add that this doesn't apply only to the recreational use, but also to someone who's been given a prescription.
Mm-hmm.
Because even for the medical user who if they are in a safety-sensitive position and they're given a prescription to use, and they only use it on Saturday night or on days they don't work at night because it helps them sleep or helps them with their pain, when they show up to work and they go for that urine test, just like what Aaron said, they're going to show up positive for THC.
Yeah.
So how do we know if that person's impaired or not? Because we don't have the technology yet available to determine if that THC level is something that cannabis that they used right before work, or if it was a couple of days ago. And this is where a lot of employers are running into trouble right now.
Yeah.
And they don't know
So,
what
I mean,
to
how
do.
long is that going to take? And then in the meantime, what do you do? Because that's your job. That's what you're doing, is you're promising, well, I don't know, tell me what it is actually that you do at Vector Medical.
So, I mean, we work with various industries across the country, and they all have different challenges because they all have different obligations to their unions. They all have different legislation that relates to the specific industries that they're in.
Mm-hmm.
And one of the things that really comes out of a lot of these discussions with the employers is, how does this fit in with our current policies? And what will we allow in the workplace?
Mm-hmm.
And I would say almost across the board in safety-sensitive industries, employers are not willing to go the route of, if a person has THC in their system, then we're comfortable putting them back into a safety-sensitive job.
Right.
Which brings up the whole conversation around accommodation. What does accommodation mean?
Mm-hmm.
It's a
Exactly.
word that a lot of people use, but there are different layers to the accommodation. So, segueing from what I was just saying, there's accommodation in non-safety sensitive duties. So is someone who has a job where, you know, they're working and doing very dangerous work, can they be accommodated in a job which doesn't have that same kind of danger level to it?
Yes.
And therefore be able to continue to use their marijuana without the employer feeling concerned about safety issues? That's one type of accommodation. I think the primary type of accommodation people think about or talk about is accommodating the use of marijuana in the workplace. So can someone smoke a joint or use a vaporizer?
You mean actually in the
at
workplace?
At work. And a lot of discussions around, does there need to be a designated area in the workplace the person
Right.
could smoke it?
Yeah.
Comes up a lot in hospitals, for instance, where you have patients who are in hospitals who want to be able to use their marijuana, but there are also hospital staff and a workplace there that is concerned about their employees being
Okay.
exposed to,
Okay.
you know, nurses and doctors.
Now, let me just ask you a frank question, and this goes back to what you said. You said that even if we're using it medicinally, even 2 weeks later, the person's not using it to get high. They're using it for medicinal reasons, but there's still some cognitive impairment that can last a week or two later. So what kind of job would be good? How could it, what job would the person do where they can allow that kind of steady, lower cognitive, because they're using a drug?
And I think it's a difficult question because if
I mean,
someone...
they don't have to be a pilot. What about just an accountant? Do you want your secretary to be somewhat dulled out?
Right, and
So
I think this doesn't apply to cannabis, it applies to any medication.
yes.
And this is where
Right.
most workplaces usually have a drug and alcohol policy.
Okay.
And if there's a medication that can potentially be impairing to them,
Yes.
they might need to be accommodated, like Aaron was
Yeah.
describing. And there are some positions that they can do for which, they might be slightly impaired, but it might not be significant enough for the job that they're doing if they're not non-safety sensitive, if they're not in a
Okay.
safety sensitive position.
Yes.
So
And there's only 25% of jobs in Canada are safety sensitive. So, I mean,
Yes.
there's 75% of all other workplaces and jobs in Canada that are non-safety sensitive. So the question really becomes, okay, well, there's this sort of dilemma that an employer faces with, do I have the right to engage the individual and find out about their medical treatment and what's going on in their personal life
Yes.
versus performance in the workplace. So I have,
Right.
as an
Yeah.
employer, I want this person to perform. I want my secretary to be on the ball, and I want anyone in my organization to
But
really be doing their job
do I
properly.
have the right
but
to
do I have the
pursue
right
that?
to
Yeah.
sort of, get a microscope and look very closely at that versus safety-sensitive industries where there's a real concern about someone being killed.
Yeah.
And again, it's not just about medical cannabis, it's about any type of impairing medication.
Yeah.
So the conversation becomes quite loaded when we're talking about medical cannabis because it's not like any other medication. It doesn't have that drug formulary profile where you're looking at a specific drug that is prescribed with a specific, it's not a specific pill or
something that's been tested and we know the
Yeah.
pharmacology of it and how it works. The cannabis doesn't have a DIN number, which is any drug that's been approved in Canada to be used for pharmaceutical purpose will have that, and it's been tested extensively. Health Canada doesn't recognize cannabis as a proper medication. They recognize the right of a patient to use it, but it hasn't been actually recognized as a form of
Does that
medication.
have any impact on the legality of a workplace, the fact that it doesn't have this official designation?
Well, I think that's the thing that employers really struggled with initially. But I would say, in general, it's been accepted in the same category as other types of prescribed medications when it comes to the discussion around how do we handle it. Do we handle it as an illicit drug, or do we handle it as a medication? So I think across the board, I mean, I can't speak for everyone, but it seems like it's categorized more in the medication category. But at the same time, it's loaded. There's a lot of discussion around that because no one can kind of figure out exactly how it fits nicely into that medical category. Because it's just not like other medications.
If you could make one suggestion that would really help, what would that be, like for the workplace, like looking forward, especially as we're looking into the legalization of it, just in general?
Well, from a medicinal perspective,
Well,
I would say,
okay.
I'll address that first. I would say it's really in the employee's best interest to disclose that they're using it. Especially if you're in a safety-sensitive job, you need to come forward and be honest with your employer about it so that there can be a real discussion around how can we accommodate your use of medical marijuana while you're working in a safety-sensitive position, acknowledging that your role as an employee, that you also have a responsibility to your employer. It's not just a one-way street. When it comes to recreational use, well, that opens up a whole new discussion around I don't have to tell my employer what I do on my spare time.
Yes.
And if I'm not using at work, or if it's just something that everyone else is allowed to do, then how can what right does my employer have to have? So the recommendation for that is we need to see. I mean, I don't have any specific recommendation.
And what about you? What would you like to see in terms of clarifying this muddle that we're kind of
I think, to
walking
be
into?
completely honest, I think we're going to be in a little bit of an unknown territory for the next little while until, we're talking about a substance that's been illegal it's still illegal.
Yes.
We're in the process of making it legal, but and anyone who was raised in the previous generation, this generation, was educated this was a drug of abuse. And only now we recognize that, well, there is some potential medicinal purposes to this plant. And I'm talking about as a society. And now we're trying to figure out, well, how do we move forward with this? And I think science is trying to play catch-up now so that we'll be able to answer these questions. And the key thing is research. I think we need lots and lots of research in this area by the government, by different parties, and stakeholders, so that we can learn more about this and figure out what to do. That's what I'd like to see.
So we've got a couple more minutes. So if there's something that you really want our viewers to hear, why don't you give your bit? We've got 2 minutes, so you get about a minute.
I think I just wanted to address the fact that even for cannabis that has low THC, so some strains you can buy from a licensed producer that is very low in THC, less than 1%, and most of it will be on CBD, so the non-psychoactive compound. Even with that strain, it's not necessarily safe to go back to work. First of all, we don't have any studies that have been shown that CBD is actually doesn't cause any impairment. We think it doesn't, but we don't have any studies. But the second issue is that even these strains will have a small amount of THC, which will show up in the urine when somebody goes for that testing. So we don't yet have a strain that's pure CBD and no THC that allows someone to return to work.
And just for viewers, in case they don't know, that the standard amount of THC now in marijuana is about 20% or so?
Well, it ranges from less than 1% to around 30%.
Okay. So Aaron, you've got a minute. Do you want to say something that you really want people to hear?
Sure. Yeah, I was actually going to say something about the CBD piece as well.
Good.
I would just say that as legalization looms on the horizon, that individuals have to think about how their use of the substance outside of the workplace is going to potentially impact their work in the workplace. And yes, it's not just about the safety aspect. It's not just about safety-sensitive jobs. It's also about coming to work and being able to perform your job effectively and to the standards of what your employer is expecting from you. So whether it's medicinal use or whether it's recreational use, cannabis is not a benign substance. It can impair you and it can have after effects as well. So that's something that needs to be considered.
That's all the time we have, and I really want to thank both of you for speaking with us tonight and sharing your insight and experience about marijuana. So that's all the time we have today. Thank you, our viewers at home, and thank you, Dr. Nachim and Aaron Spodek, for helping us understand the perplexing issue around medicinal marijuana. Perhaps this knowledge can help us develop a reasoned and compassionate response towards prescribing this drug. We can promote good quality of care that will help our patients, as well as provide solid workplace precautions that can ensure public safety. I'm your host, Dr. Vera Tarman, and thanks for watching Toronto Speaks Addiction.